Diabetes is reaching epidemic proportions in the U.S., and it's killing more people every year. The biggest single problem is not the diabetes itself, it's the lack of knowledge about this chronic disease. Tonight, we want to introduce you to a doctor who's trying everything he can to stop what he calls a diabetic tsunami from wiping out whole communities. We must warn you, this story contains graphic images which may be disturbing. Here's correspondent Michael Oku.
It's Saturday morning in the heart of Inglewood, and at In the Cut barbershop, the conversation's already crackling.
Dallas hasn't really scored over 100. No.
It's a window into much of Black America on the weekend, where for generations, the local barbershop has been a traditional gathering place for men. But if you listen closely, the buzz you hear isn't just the sound of a cut and a shave. It's also the sound of lives being saved.
Wow. You think you can start smoking on your own?
One Saturday every month, Dr. Bill Releford rallies a team of healthcare volunteers to make house calls at Black-owned barbershops. Anyone who drops in for a cut gets a free checkup for diabetes, a major cause of heart disease, blindness, and amputations.
Your blood pressure is normal because it's within range.
Releford, a podiatrist, got the idea 4 years ago after realizing Black men, many uninsured, were among the least likely group to regularly visit a doctor.
112 is good, it's a normal range. African American men have the lowest life expectancy of any segment in the country. African American men are more likely to have a heart attack and stroke, and 20 times more likely to have kidney failure and to be on dialysis. I heard you had a diabetes episode.
Today, the Black Barbershop Health Outreach Program has screened over 10,000 men in 50 cities nationwide.
149 over 79, that's very high for someone your age.
Many have never been in a doctor's office their entire adult lives.
Some of these folks end up being completely surprised that they have diabetes.
They call it the silent killer.
And just minutes later, inside the shop, news of another diabetes casualty.
My father passed, man, less than 30 days ago from a massive heart attack.
Is that right?
Yes, sir.
I'm
So,
sorry to hear that. My
yeah,
prayers are with
yes,
you.
I appreciate
Was he diabetic?
Yes, sir.
Is that right?
Yes, sir.
The silent killer is now reaching epidemic proportions across the country. Nearly 26 million Americans have diabetes. Another 79 million have prediabetes. If the trend continues, it's estimated by the year 2050, 1 in 3 Americans will have the condition. And diabetes hits minority groups especially hard.
Here in Los Angeles County, 12% of African Americans have been diagnosed with diabetes. That's twice the rate of Caucasians. And there's also this. Medical experts predict that for every 2 African American children born today, 1 will develop type 2 diabetes. And for the first time in American history, the very first time, it's projected that those children will have shorter lifespans than their parents.
The situation is horrific, and I believe it's a situation where we need all hands on deck right now, because if we don't do it, I think our already fragile healthcare delivery system is going to be overwhelmed with all the complications from this preventable, that's what blows my mind, this preventable disease.
That preventable disease, type 2 diabetes, is primarily caused by obesity and a lack of exercise, pitfalls of the American lifestyle.
The hamburger, I call, in fast food, some fast food items, the real weapons of mass destruction. When you see all the lives that are affected, all the death and mortality we see with obesity, something's got to be done about it.
And that's why, at times, Dr. Releford sounds more like a mother
You eat a lot of vegetables?
than a medical specialist.
You got some pretty good blood, that's for sure.
He's hoping he'll only see these men at the barbershop and not back at the office, where he spends most of his time salvaging the feet of diabetics.
I can't help noticing that you are right across the street from a cemetery.
How convenient, because that's a good way for me to convey my message to people that if you don't do the right things, then go across the street and see what they're doing over there.
Again, a warning. You may find these images disturbing. Foot ulcers, gangrene, nasty open wounds, the harsh side effects of diabetes that can lead to amputation, and a grim reality of a growing condition. Which brings us to the story of 60-year-old James Tolbert.
My foot was amputated in '08 on my birthday. I went to the doctor because I had bumped my foot on an ironing board, and 2 weeks later it just started smelling real bad. And I went to the doctor, and 15 minutes later I was going down the hall on a gurney, and that was the end of my foot.
Tolbert didn't have medical insurance and didn't manage his diabetes.
But my first bill was $99,000 for this amputation. Got it? So, you know, I'm behind the 8 ball all day, started behind the 8 ball. So it's hard to catch up.
On the day we meet him, it's his first visit with Dr. Releford in nearly 2 years. His amputated leg has developed an infection.
You need to stay in better touch with me. I haven't seen you since last year.
Yeah. It was a financial situation, Doc.
I understand.
Couldn't do anything but pay my rent and eat.
Releford pushes Tolbert to eat fresh foods. It's a prescription that's become a mantra.
5 colors every day. Fruits and vegetables, something purple, something red. Beets, bell pepper, something yellow. Squash, something white. Onions, garlic, leeks, something orange, carrots. So you get the picture.
Right.
Your plate should look like a rainbow or a flower.
But following the doctor's orders is tough when there's little access to healthy foods, an obstacle in much of Black Los Angeles. And when patients do find fresh produce, there's the problem of how to pay for it.
Like he says, you got to eat the whole rainbow. And now a bell pepper is $2.49 for 1 bell pepper. And you're gonna need more than 1 for a week. So if you're eating all those colors, it's gonna cost you at least $30, $40 to go to the grocery store. And that ain't no joke.
For Tolbert, it comes down to this: buy food or buy medicine.
But I'd rather clean my foot because I can drink water and eat some crackers or something, you know. But, you know, it's the thing about that's why I'm a little smaller now.
The next patient we meet is 43-year-old Riley Washington. Washington's diabetic, and he's hoping the doctor can save his foot.
Show me where did they want to amputate before.
Let's say just below the knee right here.
We saw a 43-year-old patient today whose foot was recommended for amputation. Would we have seen that, a recommendation for amputation, with someone so young 20 years ago?
No, what we're seeing now are people that are diagnosed earlier, in their late teens and early 20s. And with the earlier diagnosis, you have an earlier onset of complications.
New generations in the African American community are facing a diabetic time bomb, triggered by fast food diets, insufficient exercise, and a lack of accessible health care. Dr. Releford is attempting to diffuse the disease, cut by cut, patient by patient, sobering, since he concedes there's only so much he can do.
When I see patients that are in the office, they're crying and they're tears when there's nothing else that can be done, that did not have to happen. And that bothers me the most.
For SoCal Connected, I'm Michael Oku.